Hi, my name's Caitlin. I'm going to be your student nurse today. Can I have your name and date of birth?
Sir Maloney, 10/12/2003.
Awesome. And I'm just going to start by asking you a few questions. Do you know the president?
Joe Biden.
And you know where you are today?
Skills Lab.
And you know the date?
July 19th.
And can you smile for me? All right, awesome. So patient is awake, alert, and oriented, ×4. She can follow commands. Her speech is clear. Her affect is appropriate, and her face is symmetrical. I am going to go ahead and I can see that you wear glasses. Can you see well with your glasses?
Mm-hmm.
Okay, so her sclera is white. I'm going to check your pupils. All right, her pupils are perla and they dilated 3 millimeters. I'm going to check your nose. Nose is patent and open. Okay, oral cavity is intact. The patient doesn't have any missing teeth or dentures. And have you ever been told you're hard of hearing?
No.
No? Okay. You don't use a hearing aid?
No.
Awesome. I'm going to go ahead and do some vitals on you. So I'm going to verbalize doing her temperature, which would be 98.6. I'm going to start with the pulse ox, put this on your finger. And I'll do your blood pressure in a second. I'm going to first do your heart rate and your respiratory rate for a full minute. All right. The pulse ox is 98% on room air. Now I'm going to do your heart rate and respiratory rate for a full minute. 1 second. Okay.
Heart rate was 66, respirations were 16. Okay, so just got to inspect the eyes. So the sclera are white. There's no redness or swelling around the eyes, and then can I get you to look up for me? Nose is patent and open. Alright, there are no lesions in the mouth. Do you wear hearing aids? You've never been told you're hard of hearing? You wear any dentures or partials? Okay, so now I'm going to look at the pupil size. So both pupils are about 4 millimeters.
All right, so her heart rate was 68 and her respiratory rate was 16. And then I would do her oral temperature, which is 98.6. I'm just verbalizing that for the video. Now I'm going to do her blood pressure. On. See, this little guy is stuck on here. Okay, there we go. Okay, so your blood pressure. All right, the blood pressure was 116/63. And now I'm gonna go ahead and do the cardiac. So I'm gonna check your pulses. All right, strength is, or the pulse is 2+. For the radial, and your pedal pulse is 2+, and your capillary refill less than 3 seconds. And I would do it on the toes, but she's wearing socks, but it should be less than 3 seconds. All right, now I'm gonna listen to your heart. I'm gonna start with the diaphragm side, and I'll listen to aortic, pulmonic, Erb's point, tricuspid, and mitral. All right, now I'm gonna do the bell side for any murmurs or clicks. listening for any of those. Aortic, pulmonic, Erb's point, tricuspid, mitral. Alright, so the rate and rhythm was regular. There were S1 and S2 sounds were noted, and there were no murmurs. I'm going to go ahead and move on to your respiratory, so I'm just going to listen to your lung sounds. If you can sit up for me and just take a deep breath every time you feel my stethoscope. Alright, so the respiratory rate and rhythm was regular, the lung sounds were clear, there was no signs of accessory muscle use, and the chest and back rose and fell equal bilaterally. Okay, so after respiratory, I'm going to go ahead and look at your skin. The color is appropriate, there's no wounds or lesions. I'm going to feel the temperature is warm, and I'm checking for edema. Alright, there's no edema present. I'm going to move on to your abdomen now. You can just lift your shirt up for me. And I'm checking the abdomen is symmetrical, color is appropriate. I'm going to listen to the 4 quadrants of your abdomen now. And I'm starting in the right lower quadrant, right upper, left upper, left lower. Alright, bowel sounds were present in all 4 quadrants. I'm going to do a light palpation. Let me know if you feel any pain or tenderness. Any pain?
No.
Okay, and when was your last bowel movement?
Yesterday.
Awesome. And did you have any constipation, diarrhea, or vomiting?
No.
Okay. And when was the last time you urinated?
This morning.
Okay, and how was the color?
Yellow and clear.
Okay, awesome. And you didn't have any problems urinating? No pain?
Nope.
Okay, awesome. I'm going to go ahead and do your musculoskeletal now. So I'm going to ask you, do you use any assisted devices to help you walk, like a walker?
No.
No. Okay, so the patient is self-ambulatory. I'm going to go ahead and have you squeeze my hands. All right, grip strength is good. And then pull apart, good. All right, so the grip strength was strong and they were equal bilaterally and it was 5+. I'm going to have you push down on the pedal and push up. Okay, awesome. So the strength was 5+ equal bilaterally. And finally, I'm going to check the patient for any IVs, drains, or lines, and I have noted that she doesn't have any present, so that will complete my shift assessment.